Congratulations on the purchase of your #1 fitness inversion table. If you're like most people, you're probably looking for a way to reduce back pain, reduce stress, improve circulation, improve posture, return balance and symmetry to your body, or decompress after a good workout. Now this video will help you learn more about your inversion table, and it consists of 4 parts: balance settings, partial inversion, total inversion, and the most common questions and answers. Be sure to read the following instructions in your owner's manual before inverting. In order to test the balance settings of your inversion table, there are 3 settings that we need to consider. First, the pivot arms. They need to lock into place. Until you become comfortable with your inversion table, it's recommended that you use the pivot arm in the last hole. Next, we need to consider the nylon strap that's at the base of the main frame. Now this can be adjusted for a greater or lesser degree of inversion. You need to make sure that it's connected firmly onto the main frame there. When the strap is connected, you won't be able to go totally inverted. Start out with about a 45-degree angle or whatever you feel comfortable with. Finally, make sure the adjustable boom is positioned properly. It has markings on it for inches and centimeters. So if you're 5'4", you want to adjust it so you actually see 5'5". Now once you have all the settings set properly, you can get started with your new inversion table. Now the first time you're using it, it's recommended that you use a spotter. The first thing you need to do is stand on the instep frame and then pull the spring-loaded pin. Make sure it locks into place to secure your ankles and feet. Now this is going to support you as you rotate back and invert on the table. Next, lay back and lay your head on the table and rest your hands on your chest. Now if the main frame lifts up off the A-frame, you probably have it positioned and balanced properly. Half your body weight should be positioned above this pivot point and the other half below this pivot point. You can rotate either way by moving one or both arms back. After you've inverted for a little bit, your body may have become stretched or elongated, and that when you come up, you may not have come up all the way. So to help that out, all you need to do is slightly bend your knees. You'll slide down and be back into the upright position. If you lay back on the table with your arms on your chest and there is no movement on the table, this means you have an incorrect passive setting. So what you'll need to do is step off the table and reset the adjustable boom by increasing it by 1 inch. This rotation is too aggressive because the adjustable boom is set to 1 inch too short. If you rotate back very quickly without using your arms, you know that the settings are not correct. This is called an incorrect aggressive setting. So to fix this, we will lengthen the boom by 1 inch. Now you don't have to totally invert to achieve benefits from your inversion table. Many people won't go past a 45-degree inversion, so go at your own pace and do what's best for you. Now to get the table to totally invert, you need to disconnect the nylon strap from the main frame. It's easy, just like before. Take your arms back, one at a time, and then your body will rotate so you'll be in total inversion. You can use your hands once you're down in this position, and make sure your back isn't touching the back of the main frame. Be sure to practice good, deep breathing while you're doing this. Now you'll also want to stop in the horizontal position and rest there for a few moments so you don't get dizzy on the way back up. When you're ready, hands placed at the side, bend your knees slightly, your body rotates right back up to the upright position. What angle should I invert to? You should pick an angle that's safe for you. Your body may be most comfortable at a 45-degree angle. Make sure you stop if you feel any type of discomfort. What about an increased blood flow to the brain? Extra blood flow to the head occurs the first time you invert. It's good for you, it's healthy. Oxygen rushes throughout your body with increased blood flow. You'll get used to this feeling and enjoy it more and more. How long should I invert? You should invert for the amount of time that's comfortable for you. You should start by inverting for 1 to 2 minutes and then work your way up to 10 to 15 minutes. No pain, no gain does not apply to your inversion table. So go at your own pace, take your time and enjoy your inversion table from #1 Fitness.